So the question is, can I get implants if my lower jawbone was removed and replaced with the metal plate? So the reason this follower is asking this question, because sometimes people have some certain conditions, either some cancer or other type of conditions, other type of diseases. You need to have a part of the lower jawbone or upper jawbone removed. In those instances, your jawbone is replaced with some type of metal, then that prevents you from getting some type of implants. So our goal will be to, anytime you have those type of cancer or other diseases, our goal is to be able to save your life, and that's the reason why we are not that concerned about the teeth at the time of the reconstruction. However, after having the reconstruction made, and if there is a way possible, then depending on whether you have any bone available at all, or even if there is any type of attachment that can be done to the other metal plates that you already have. So those are the type of options that you might have. Again, without seeing you, I may not be able to help you, and this is a great question that you might need to ask your prosthodontist whenever you go see the prosthodontist, if you still have a relationship with them, or the reconstruction surgeon, whoever did that. More than likely it could be your ENT surgeon or your oral maxillofacial surgeon. If you had those people who helped you with doing the reconstruction to begin with, I'm sure they probably have some kind of an option you will be able to consider to replace your teeth with dental implants. So again, get a consultation, go talk to the team who did the reconstruction for you whenever you had that jawbone removed, and they should definitely be able to help you with some kind of an option that is possibly available.